Hi, welcome to another episode of our Keep It Simple series. My name is Dr. J and we are here to talk about common urological procedures that you may have heard of but are too shy to ask about. And today's topic is indeed one of these one, and we will be talking about circumcision. Now, circumcision is actually the procedure whereby I remove the excess foreskin that you have in front of the penis, and this procedure is done across a wide range of age group from all the way newborns to 70-year-old, 80-year-old gentlemen who might have conditions that require circumcision. So what are the conditions that will make you need to go for circumcision? The most common is when you have an inflammation of the foreskin, or the prepuce as we call it, is called melanoprostatitis in medical terms. And this condition occurs when you have a very inflamed ring of the tip of the foreskin that's very tender, especially when you try to reduce the foreskin when you shower and try to clean it, or during sexual intercourse. It can be very painful experience as well. So what happens is when you have a inflammation, you pull it, you cause tears around it, and as the ring or as the prepuce itself heals, the outlet gets smaller and smaller, causing it to narrow more and more even after you recover for it. And if you accidentally re-put it down again, the whole test happens again, everything starts over again, and it has no end in sight. So generally, patients then come to me, we talked about circumcision, then that solves the entire issue permanently, and you will never have this issue again. Another common reason as to why I have to do a circumcision is when you have phimosis. Now, phimosis, pretty much the logic is the principles is the same. Very narrow ring that unfortunately doesn't allow you to reduce or pull back the foreskin. And what happens is that if you leave it alone, generally phimosis is quite harmless. However, if you then accidentally pull it down and you can't put it back up, it becomes paraphimosis. And that, my friends, is a surgical emergency, and you want to go to the nearest emergency department because first, it's very tender. Second, if you delay the presentation to hospital for more than 6 to 8 hours, there will be permanent damage to the penis. Because you can imagine, if you put a ring around your fingers, a rubber band that goes very tight around your fingers, the tip will be very uncomfortable. Leave it too long, you will have permanent side effects. Now, there are many ways as to how you can do a circumcision, and it's best to talk to your doctors, particularly talk about what you want to be done for yourself. And today I'll also be going through a bit about the complications and the entire process, and let you have a patient's perspective of what you'll be expected to go through if you were to go for a circumcision. Most importantly, I want to talk about the post-operative care, the change in the sensation you'll be expected to feel, because most of the time my patients come back to tell me it's never the pain, it's never the procedure, it's almost always the sensation change that they did not expect it to happen. With that, we'll probably go straight into some of pictures that I need to show today. I want to apologize in advance because of the nature of the topic today. Some of the pictures will be a bit more graphic than usual, but that's the only way to actually put the whole issue across to you in a very clear and simply understood manner. So I'll talk to you soon. Circumcision itself is actually done very commonly in the United States, and up to 80% in certain parts of USA. The men have circumcision done before, while it can be as little as 0.1% in the rest of the world. It is most commonly done in kids or newborn for religious purposes, particularly Islam and Judaism. And there is no clear evidence that circumcision itself can actually prevent penile cancer. What is clear in the literature is that for penile cancer sufferers, which itself is a very rare cancer, they found that most of them were uncircumcised. But that is not to say that circumcision itself has any protective effect in preventing this form of very rare cancer. Now, as I have mentioned just now in my introduction, A lot of times we do circumcision primarily because of inflammation, which can occur, melanoprosthesis, and essentially causes tenderness, particularly if you have cracks along the foreskin, and it can lead to painful sexual intercourse. Phimosis is another reason whereby there's a narrowing, and if you were to pull down the foreskin too much, it becomes paraphimosis, which is a medical emergency, and you need to get yourself to the hospital as soon as you can. Otherwise, you will risk having permanent damage. Some other reasons are when you have a condition called BXO. It is a inflammatory condition whereby the foreskin itself actually sticks to the glands of the penis, and in rare instances can actually lead to cancers in the penis as well. There are many ways as to how circumcision can actually be performed. For kids and newborns, laser circumcision as a modality is actually very common, while for adults and young adults, the traditional scalpel methods is the most common way as to how circumcision is performed. Now, within the scalpel method itself, there are also various techniques that are out there, including the guillotine method or the dorsal slits method. It is very important that you have a conversation with your practitioner to figure out what method is most suitable for your own personal needs. On the left, I have here with me on the left hand side a picture of various grades of phimosis, and we have the normal type whereby you actually have no phimosis at all the way to type 4, where there's actually a very narrow and small opening that allows urine to flow through. And in these situations, usually when you pee or pass urine, you will actually see a ballooning of the penis temporarily as the water itself is trapped underneath the foreskin. And obviously there are other grades as well, with type 3 and type 2 not being as severe as type 4. Now, regardless as to your grades, circumcision can solve all these problems when you remove the foreskin itself. And this is a diagram of how the penis actually looks like after circumcision is performed. One thing to note is that there will be a difference in the skin color regardless of the method of circumcision is done, and this is because the glans penis, which is the top part of the penis itself, is naturally pinkish in color, while the skin tone along the shaft of the penis is determined by our own original skin tone. And after circumcision, you will be expected to see a difference in the color between the glans and the shaft itself. I basically have two pictures here with me that shows two processes. On the left hand side, we have a recently circumcised individual, and this picture, what it shows is that there is a layer of slightly darker yellowish skin flakes that you can see here, and this is the process whereby desiccation is occurring right after circumcision. The most enduring thing and the most noticeable thing that you will encounter is actually not so much the pain, but rather the sensation of the glands, which is the tip of the penis here, being exposed to air, and it causes desiccation or drying of the entire surface to occur. This process usually lasts around 1 to 2 weeks, and it can be very uncomfortable during this period of time. I've always advised patients not to wear any underwear, particularly when they are on medical leave. It is advisable that they basically put a towel and cover their lower body, and not to wear underwear because it can be very sensitive to the touch. On the picture on the right hand side basically is to showcase, as I was saying just now, there will be a permanent difference in the skin tone. Generally, the glands of the penis will always be light pink in color, whereby the shaft itself will be depending on your original skin tone, and this skin color difference is a permanent fixture. Unfortunately, there's nothing much we can do about it. Circumcision. Okay, once you go for a circumcision, usually you will need to take a break around 2 weeks. As I was saying, it's not so much of the pain that causes you to be down from work or school, but rather it is the need to get used to the sensation that you will have when your glands is exposed to the environment. there will naturally be some risk involved when you do any surgery. The usual risk for any surgery exists, which is bleeding, infection, and if circumcision is not done by a trained personnel, there might be a small chance of injury to the glands, which will naturally lead to shortening. And so you do want to check and to ensure that the practitioner that you are having a consult with has adequate experience when it comes to doing circumcision. Last but not least, as I mentioned, the biggest change that you will notice is the change in sensation. This is particularly true if you have been sexually active. Your sensation, or rather the experience towards sexual intercourse, may also change as a result of circumcision being done. But if you need to have a circumcision for the reasons that we mentioned, like phimosis or inflammation of the foreskin, there really isn't much of an option when it comes to these conditions. A circumcision is the most common and the definitive gold standard method of treatment in this condition. That we will probably come to the end of this topic, and once again, this video is meant to be for patients who have previously seen me before and would like to have a rehash or a revision of what was discussed in the consult. It is advisable that if you are looking at this video for the first time, that you will need to have a face-to-face consultation with your own urologist to discuss whether you need to have a circumcision done for yourself, and particularly what are the various complications and the experience that you will be expected to go through. With that, we will talk to you soon in our next video. Bye.